So this slide here has a focus on co-occurring and differential diagnosis. So it's understanding that if we focus on and spend time understanding what else is going on for the young person, because there could be co-occurring conditions. If we do this right, then we're enabling the best support to meet their needs. And so whānau often talk about diagnostic overshadowing, which is where, they're really wanting support to understand the young person's anxiety or maybe ADHD, but everybody and the professionals see it as it's under the umbrella term. So the FASD is the main thing. So it's really trying to advocate for whānau, actually understanding the things that are also going on for them. Co-occurring conditions is really important. And we know that this is at the heart of FASD. So there's a lot of co-occurring diagnosis. So because you have prenatal and postnatal exposures, you have like biological and environmental factors, you've got genetics happening, you've got medications, you've got stress in pregnancy, there's a whole lot of, you've got neurodevelopmental conditions that can co-occur with FASD. So like autism spectrum disorder, attention hyperactivity disorder, intellectual disability, you might have dyslexia up in there as well, whānau. And then you've got the mental health conditions. So it's understanding that young person or that person that's being referred for an assessment, it's understanding the stuff that comes via the whakapapa, right? So on their line, but it's also the environment that they've been exposed to, so their experiences to date. So this slide here is focusing on the impact of trauma and prenatal exposure, and how this there's a link between the two. So what we understand here is when you have adverse childhood experiences, there is a high prevalence of co-occurrence of prenatal alcohol exposure in pregnancy. Kapai. So in our guidelines, we understand the link to that. We understand some of the challenges about, quantifying like various factors, like how much of an impact have they had on this tamaiti or on this person. But it's most importantly for professionals and for whānau, it's recognizing that there is a link. So if you have adverse childhood experiences, there is a high co-occurrence of prenatal alcohol exposure in pregnancy. Ka pai? The whakakotahitanga FASD guideline also includes good practice statements. So there's good practice statements to support the assessment process. There's good practice statements around gathering of information, whānau information. There's good practice statements regarding the actual doing the do around interpretation of all the different domains. So when we think about good practice statements to support the assessment process, again, holistic, needs-based, whānau-centered approach. Looking at the whole picture, explaining possibilities, like diagnostic possibilities. So it's really talking with whānau about what might be on top, what might be more likely, and then things that might be a bit less likely, but still important to consider. And then it's really about making sure that through the assessment process, we're not just leaving them hanging, that there is, if they require follow-up, we are going to provide information about how they can then access support. And being mindful, and this is a really important good practice statement, being mindful of the impact of our own training and our own perspective and upbringing. And that speaks to more of the unconscious bias. So there is a whole lot of good practice statements in there, but those are just a few that I thought resonated and we could discuss briefly. On this slide here, talking again about feedback and post-diagnostic support. So it is about considering whānau strengths and challenges, and what does that mean in terms of your assessment process, but then how does that link into post-diagnostic supports? So understanding the factors within their situation that increase the risk of challenges, and what's maintaining the current situation and influencing things at an individual and whānau level. Because as we know, if we can suggest an intervention, but if we don't take into account access to resources, travel, engagement, a whole lot of things that are specific to every whānau, then we miss opportunities and we make it harder for them to engage with all the different supports we're talking about. So yeah, really it's about being bespoke. It's about understanding that individual whānau and where things are at for them and how we can best support them. It's important to not just focus on the negative, so it is about being strength-based. It is so that they feel like the young person, so it really is it's about the detail. It's about helping them understand that the information that they provided to you, that they trusted you with, fits with or doesn't fit with, if that's the case, the assessment data, the different domains that were assessed. It's marrying the two together so whānau can see real life and real time the impact, both positively and challenges wise. Ka pai, so it's not two separate things. It's how do you embed what you've done, the assessment you've done, back into what whānau have provided you, so that they actually understand on an everyday level what does that mean for the young person. And then it's also about the future. So yes, it's helping them understand that, but then it's like, okay, well, where to from here? And this is where it's with whānau, not to whānau. So it's not a professional opinion in isolation. It's actually having that whakawhiti kōrero and seeing where the whānau are at and where they would like to, where they would like to focus on, what's high on what's on top for them in that moment. And then equity, so it's understanding that different areas have different access to different things. And so each context is unique. So what might work, so support agencies in Gisborne might look very different to support agencies in a bigger setting in Auckland. So how do you support the young people engaging in this FASD, or the people engaging in this FASD assessment in their whānau? How do you support them to access, to have equal access to really important services? And that's something that needs to be considered in the future as well. So just like before, there's some best practice guidelines when delivering feedback. So face-to-face, kanohi kitea, including wider whānau and key support people, so that more people can hear and understand. If we're just providing, if it's just to one whānau member, then the expectation is that whānau member is then going to inform teachers and be able to talk to some really quite complex information. So having key support people there at the feedback session is really important. Giving them time, making sure you're not rushing them, giving them space to, maybe they need to come back a second time. Once they've, as a whānau, been able to consider it, they might have extra questions. Visual resources, making sure you use visuals, because as we know, when whānau hear quite hard or challenging or really important news, sometimes what happens is they're so overwhelmed by that process that they're not actually able to hear the detail. So if you were to provide a visual which maybe has the different brains or the brain domains, it helps them to hang the information that they're hearing onto something visual, which is always going to be helpful. A hard one that I find challenging sometimes, jargon, so make sure that the language we use is not full of acronyms, is not full of big ass words. Speak plainly and clearly, and relate it back. So if you're discussing a young person's executive functioning, explain how that actually looks and feels for that person at home or at kura, at their school. Ka pai, so it's about taking what we've gained with our flash as knowledge as professionals, and it's about making sure that we make it livable and breathable, that whānau understand that concept in their environment. And then, yeah, what else would I want to say? Post-feedback check-in. So like we talked about before, understanding that they might be overwhelmed by the feedback process, but checking back with them. Maybe it's giving them further resources, maybe it's providing places that they can access support in their community context. And then, yeah, I think that's pretty much. So there's lots of, so in this section here, there's lots of best practice statements regarding delivering feedback, but those were, again, some of the ones that I thought were really important to share. Ka pai. And then we have good practice statements to support formulation, feedback, and support planning. So again, same thing again, holistic lens, include like key developmental factors and possible causes for what the challenges that are currently occurring. Explain the different possibilities of diagnosis, maybe most to least likely. Involve the whānau and key people, so it's not just one person in the room with you, it's key people, involve them in the decision making and the diagnostic decision, so share that with them. And I guess this is important, providing feedback that is pitched at the person who has entered this assessment process. So it may be a young kid, or it may be an adult who struggles with their understanding of verbal information. So it's about tailoring our kōrero and providing written information in a way that's going to reach them. Or it might be looking at online information. It might be a Vimeo on executive functioning. It's about how do you best access and best help them to understand the concept. Ka pai. And then, which is really hard sometimes as professionals, it's about allowing whānau to identify the areas that they see the most need, the areas that they would like immediate support with, which might be different from our perspective, maybe, or maybe not. So not only is it about what's top of their list for intervention, but it's about how are we going to provide, or how would they like the support to look. So does that mean another agency? Does it mean a iwi provider? Who is going to do this mahi? But it's always making sure that the intervention fits with their social, their cultural, their unique context and beliefs. And again, it's being mindful of our own bias. Just because we think that maybe a certain parenting program would be great, it's about looking at what the whānau are wanting in that moment. Yep, my last slide to talk about is resources. So the great thing about the Whakakotahi FASD guidelines is that we have provided links to New Zealand-based resources and also to overseas resources. We do state, it is be wary about terminology, because it could be a little bit different if you're looking at overseas websites, but there is such a wealth of information there for whānau, for professionals, for anybody working with FASD.